Prescription drugs play an important role in modern healthcare. Medicine in a pill, liquid, or patch form helps in healing physical ailments and following medical procedures. Mental health conditions, including anxiety, depression, and the learning disability attention deficit hyperactivity disorder, also benefit from these powerful medications. But if these same prescription medications are misused or abused, they could pose a health risk to you with a number of potentially serious side effects.
Chest pain, elevated heart rate, elevated blood pressure, nausea and vomiting, constipation, dizziness, and oftentimes falls, all related to the misuse of their prescription medication. Most of these problems can be avoided very simply. Take your medication as prescribed.
It is very important for patients to take their medications exactly as prescribed for multiple reasons. Some medications need to be taken at the right time in order for them to be the most effective. Other medications need to be completed, such as antibiotics, even when patients are feeling better. And other medications shouldn't be taken more than the amount prescribed, or that can lead to such things as physical dependency and abuse. It is extremely important for patients to ask questions. Patients need to understand potential side effects of medications, potential drug interactions, such as with other medications, supplements, or foods that they might eat. And they really need to understand why they're taking a particular medication.
If you do experience new symptoms or symptoms that could be side effects to new medications, dose increases of current medications, or if you start any over-the-counter supplements or medications, your doctor should be made aware of anything that has come up.
Some medications, such as those prescribed to treat pain, anxiety, and insomnia, have the potential to be abused and cause addiction. What patients need to understand is that when taken properly, exactly as prescribed, and not mixed with other substances such as alcohol, these medications can be a safe and effective way to treat their symptoms.
I was wondering if I could have a glass of wine while taking Xanax.
I would not advise for you to mix Xanax with alcohol. Both of these are sedatives. That means that they can cause side effects when used together, such as oversedation, risk of making you fall, or mental status changes.
Alcohol, whether it be liquor, wine, or beer, is going to have interactions and side effects in your daily living. For instance, alcohol can cause sleep disruption, weight gain, irritability, and other mood changes. It can also interfere with pain medication and anxiety medication, specifically controlled substances. What alcohol can do with the controlled substance is cause dizziness, somnolence, intoxication, things that can ultimately be dangerous or life-threatening. If you do find that you're overusing your medication to change how you feel, it's important for you to feel comfortable talking to your doctor about this. Your doctor wants to work with you to help bring out the best outcome for you and your medical conditions. Remember, communication with your doctor is the most important thing, especially regarding side effects and new symptoms of current medical conditions. Your doctor wants to know what is going on and what is changing in your life.
Patients can help doctors by always carrying an updated list of all their current medications, utilizing only one pharmacy to fill all their prescriptions, and bringing their pill bottles to each and every visit with their provider. And remember, patients are an important part of the medical team. Doctors rely upon information given by patients to help them deliver the best medical care. Don't be afraid to ask questions.
Going to the doctor's office can be an overwhelming and nerve-wracking experience, especially when you have serious or multiple medical conditions. A family member or a health proxy can help you remember your questions, recall side effects or symptoms you may be having that you're not aware of, and they can provide the emotional support you need during a visit to make sure that all of your needs are being met and all of your questions addressed. The best way to prepare questions for the doctor's visit is to write a list. Some people do have notebooks dedicated to recording questions and answers to those questions in the visit. It's important for the patient to list all of the medications that they are taking, whether they be prescribed, over-the-counter, or natural supplements that you find in any pharmacy, supermarket, or vitamin store. Any pill or capsule that you take could have interactions with medications prescribed or have side effects. Even caffeine teas or special supplement teas could have interactions that keep you awake or cause other side effects.
Oftentimes, your physician will refer you to another doctor who will give you a prescription, and then another doctor will give you a prescription, and before you know it, unless someone is monitoring that, you may be taking medication that, quite frankly, can put you at risk. Your doctor needs to know all the medications you're on.
Taking prescription medications not prescribed to you creates potentially dangerous risks, in addition to being against the law.
If you take that medication that wasn't prescribed for you, it's like playing Russian roulette with your health.
There's never been a good reason to underdose a medication. Underdosing to save money actually costs an awful lot more money and suffering. If you underdose your medication, more than likely you end up with serious side effects or in the hospital. If you overdose medication, then you get into the probability of misuse or abuse, and depending on the type of medication, the side effects may be far too severe for the average person.
Possible risks include dangerous side effects, negative interactions with other drugs, and also the possibility of an overdose that could lead to death.
My advice to you is always contact your doctor if there's a question. Nobody knows you better medically than your primary care physician. He or she can give you the advice that you need.
3/4 of people who abuse prescription drugs get them from a family member or a friend. It could be someone who's abusing them, could even be someone who's selling the medication to someone else who is also abusing them, and those risks could lead to potential for bad drug combinations. They also could possibly lead to a drug overdose, and so that's why it's so vitally important to monitor and protect your prescription medications. I'm aware of one case locally where a child in a middle school took medications that were prescribed to an adult in the home, and they overdosed and died. And it was a tragedy we want to avoid at all costs.
Make sure you protect your medication from children. They have safety caps and non-safety caps. The second way is to use a lockbox. A lockbox protects your medication from everybody. They have combination lock boxes you can put your medication in. They have key lock boxes you can put your medication in. It's also important to organize your medications to prevent misuse. There are programs that help you keep track of your dosage intake by days of the week, hours of the day, and also serve as reminders. And also there are apps for your cell phone that can remind you when your medication should be taken next. When medications are unused or outdated, they should be put into a jar or a can with a lid, a little bit of water, and some coffee grounds or cat litter, and then the jar or the can sealed and thrown in the trash. Another way people get rid of old or unused medication is through prescription take-back programs that will properly dispose of your medications for you. Bold's website or your local community pharmacy should have information on the next program. We're all personally responsible for our own health care. We need to open communication with everyone, whether that's your physician, whether that's your nurse, whether that's your pharmacist, whether that's your physical therapist. We all need good advice to make sure that we are doing the correct thing.
Life is much easier when you and your doctor have a good working relationship, when you inform them of the medication that you're on, when you inform them of any changes in your health, when they are the gatekeeper of your care. The primary care physician that you have is your portal and your gatekeeper to safe and appropriate care so that you can live a long, happy, and productive life.
Please remember that prescription drugs are a powerful and important tool for improving health if they are used properly. Also remember to secure your medication, take them as directed, and pay attention to all warning labels on the bottle. If someone you know may be abusing, dependent, or using prescription drugs recreationally, please call the following phone numbers. Here are additional websites, including our own Bold Coalition website with lots of great information on our work and how to get help. See us on Facebook too. Thank you for listening.